Ready to call this meeting of the Finance and Facilities Committee of the Waukesha Board of Education to order. First up is verification the meeting was properly posted.
Yes, it was.
Thank you, Darren. Next up is opportunity for public comment. We're now at the section of our meeting where there is an opportunity for citizens to speak. We have one speaker this evening. Because there are 6 speakers or less, speakers will be notified at 3 minutes, but allowed up to 5 minutes to complete their comments. We expect all speakers to honor our time limit, refrain from using any inappropriate language, and be respectful in their comments. Speakers who do not meet these expectations may be prohibited from speaking at future board and/or committee meetings. Speakers are here to address the board, not the audience. The school board and this committee does not endorse any comments made by members of the community here tonight. We would like to remind our community members of the impact of their words on others and that our children are watching. We commit to communicating with you in respectful and productive ways and ask that you do the same. We also expect that the audience will be respectful of the speaker and of the board and refrain from responding with verbal comments, cheering, applause, or other behavior that will detract from the meeting. Please note that no obstructions can be created between the board and the audience, visual aids cannot be used, and the area behind the speaker and podium will be clear during public comment. Also, in order to respect our speakers and meeting participants, please silence your cell phones. Tonight, we have one speaker signed up, and that's Mr. Paul Reese.
Good evening.
Good evening.
One thing I'd like to know is why my daughter starts high school and my life gets busier. It's unreal. But tonight I want to talk about healthcare compensation for our teachers' aides and the lack thereof. And the differences between, because I've talked about this before, but not just the fact that they don't get health care, but the total cost differences between what a teacher is compensated and what our aides are compensated. I'd sure like to know what that is, and including pension as well in that, and everything else that what the teachers, the cost to the district for a teacher at, let's say, North High School, West High School, what the cost is compared to the cost of an aide. Because it's not that they work that much less. The aides, just because they don't have a loudmouth union pushing for them and everyone up here screaming that they're worked so hard for 9 months of the year, they're just as important in what they do, and sometimes even more so for some of our kids. And the fact that we don't hold on to aides and that they're needed. I know people who are, my wife's a teacher's aide, and she follows kids throughout their career at a school. She'll be assigned to them, and she gets to know them because that's what she has to do to aid that child through school. And when they have IEPs that require that. So then those are just some questions I have for this district, because I know, and I'm not saying that, one thing I want to be clear is I'm not asking to increase costs to for this. There also can be shared cost here. We also can look at how much we compensate our teachers and other employees in this district for their insurance, and take some of that and share it to show that all these employees are equally valued, and share this cost amongst our teachers' aides as well. Not just say we're going to we just put a whole bunch more money onto our budget, but to share the cost of this, because it's not fair that some are just are ignored. They're simply ignored. That's just because they don't have a loudmouth union doesn't mean that they're worse less than the rest of the employees in this district. So, anyways, thanks.
Thank you, Paul. Is there anyone else that would like to address the committee at this time? Seeing none, moving on to our action items for the evening. First action item is approval of minutes from the September 12th, 2022 F&F meeting. Looking for a motion.
Move to approve.
Thank you, Ms. Dr.
Second.
Kazak. Thank you. Is there any discussion on the minutes? Seeing none, all those in favor say aye.
Aye.
Opposed? 4-0. Moving on to our next action item, which is the approval of the vouchers. Sherry, any questions?
Nope, no questions.
No questions today. Looking for a motion for approval of the vouchers.
So moved.
Thank you.
Second.
Thank you. Is there any questions that might have arisen before this evening that we didn't send to Sherry? No? No? All right. All those in favor say aye. Aye. Opposed? 4-0. All righty, moving on to discussion information items. First up this evening is the employee clinic report.
Yeah, Pete and Vicky, if you want to come up and I think that microphone should be live.
It's hot.
I think. I don't know if it's switched on, so maybe tap it and see if. Oh. So, several months ago now, we entered into an agreement with Prohealthcare to run our employee health clinic, and the transition date was the first business day of 2022. So we thought we had enough data at this point to come back and update you on the progress we've made, talk about revisit the change in location that we talked about last month here, and the reviews. I think you'll be pleasantly surprised to see the reviews we're getting from staff as they answered their surveys on their cell phones, and then talk a little bit about the cost savings, and then kind of a sister report. Jeff Schultz is here from HNI to talk about our overall health plan and health strategies, and so I'm asking PHC to stay through Jeff so we can answer any questions you have. But overall, I think it's a set of very good reports. So I'll turn it over to you guys, and we'll answer any questions you have on the clinic.
Well, Darren, thank you. My name is Pete Bacon, Chief Integration Business Development Officer for Prohealthcare, and Vicky's the star of the show here. I'm just here to provide moral support. But I did want to thank you folks for giving us the opportunity to be here. We certainly appreciate the opportunity to serve the district, its employees and families, and I think it's been going extremely well. We get a lot of feedback in the community, and it seems like people are happy with where we are. Doesn't mean that there aren't areas for us to make improvements, and I think the new site that you talked about last month was a site. I mean, it's easier for people to get to, and that's really, when you're looking to build access to a program, that's really what you want to do. I think we'd be able to do that. So, like I said, Vicky's the star. She's the one that is here to really report on it, and I just want to thank you folks for giving us the opportunity. We'll stick around for questions, so thank you. Star?
Thanks. Yep. Okay, thank you. I'm Vicki Hvac. I'm the Vice President of Population Health Management. Been working with the district diligently for several years now. Finally got our program off and running on January 1st of this year, but prior to that we did complete our HRA and flu program in 2022. So we'll go to the first slide. So meeting the goals. So if you remember when the RFP came out, you all wanted to have a program that was accessible, quality-driven, patient experience or patient-centered, utilization of technology, and affordability. And we're going to go through the presentation 9 months in to let you know how we've done thus far. I think you'll be pleased. So we'll go to the next slide. So if you recall, the clinical program was our near-site program, Brookfield and Waukesha. We'll update you on the new site, Waukesha. We have a photo, but the team chose Brookfield and Waukesha Memorial as our two sites. We are available 40 hours a week. Actually, we're available a little longer because we do have virtual to 8 p.m. every single night, and on the weekends, 8 a.m. to 4 p.m. Starting January 1st, we'll be open till midnight, 8 a.m. to midnight for our virtual house, so your members will be able to take advantage of that. We have in-person care, both for primary and episodic and urgent care, and that's been going swimmingly. We also have employee and occupational health, so when you hire a new staff member or a staff member gets injured, we see them in our occupational health or employee health aspect. We also do your wellness programming, and that's the HRA, which kicks off tomorrow, and our flu program, which kicks off tomorrow. We actually come to every one of the schools that have been outlined in the program. We'll be with you 19 days straight, making sure that folks get their HRA and their flu shot. This is for employees and spouses of the district. We'll go to the next slide. Just wanted to kind of level set on the locations. Here's our location at Brookfield, brand new building. Actually, when we moved in there in January with the school district, we've only had been there less than a year. Our Waukesha Sunset that was just approved, we've only been there several months. It's brand new on Sunset Drive facing Spring City Drive. So it's Spring City and Sunset. So if you know Sunset, it's kind of right behind there. We wanted to go over a little bit of statistics with you all and kind of talk to you about Prohealthcare's program as compared to the previous program with your previous vendor. We've seen 884 participants, employees, spouses, dependents, since we started in January. And these visits, which we count, are acute visits, so if someone's ill, preventive health visits, if they want, age-appropriate prevention for their children, themselves, or their spouse. And we also see folks for virtual, chronic care, employee health, occupational health, and occupational follow-up. And we're a little different than the previous model. The previous model also had physical therapy. That's one thing that we don't offer in the clinic, and we don't offer a medication dispensary. We have seen 3,388 folks since we started. That includes the HRA and flu program. Prior to that, in 2021, the clinic that you had saw 2,677. So when we compare apples to apples, we are actually a little bit ahead of the amount of volume that's been seen at our clinic here between Brookfield and Waukesha. We'll go to the next slide.
One thing that before so I don't forget, it used to be if you filled your script, you had an appointment as well. So you were counted as part of,
Right.
even without that,
Right.
we are ahead
Quite
of the game, just so you understand the math.
Yeah. Thanks. We'll go to the next slide. So the patient promise and the experience. We promised accessibility, scheduling your appointment, phone with text verification and phone notification, online verification, and check-in prior to appointment. I think your participants, your employees, dependents, and spouses really like that. If you saw the previous slide where I talked about virtual, that is the second highest way your folks want to be seen. So they want the acute visits and the preventive visits, but in the January timeframe, January, February, March, it was really a lifesaver for us because we were in the height of COVID. So your employees really utilized the service, and so did your dependents and spouses. Now that we kind of are out of the woods a little bit with COVID, those virtual visits are being used for primary and chronic and acute care. So that continues. So that technology piece that we talked about originally is true, and your folks really like technology. The visits, seeing our provider, so face-to-face, virtual or walk-in, we're able to address issues. They walk out with a diagnosis and a plan at hand. Everyone is signed up for MyChart, so as a new employee, they are signed up as MyChart. When they do their HRA, they're signed up as MyChart. And when they do their flu shot, so 100% of your employees, as well as their spouses on the health plan, are on MyChart. And that's really fabulous. It's like unbelievable. So we're able to communicate with your folks. They're able to communicate with us very easily. And I think that's been a win-win for all of us. And then after visit, next steps in the service standard is when you leave, we want to make sure that you have what you're to do next. Do you schedule an appointment with us? We see you back annually, etc. Do you need a medication refill? All of those good things that when you see your physician or provider, we call that an after visit summary. All of the notes are available to your employees, dependents, and spouses almost immediately, so that when you finish the appointment and you can't remember exactly what they said or actually what was done in the visit, you actually can read word for word which has been written about you and your concerns and your follow-up plan. We also alert folks right after the visit. We'll go to the next, and of the 800 plus folks, 253 people responded to our survey, which is 33%. For a survey, that is huge. We usually receive 18 to 25% of folks will fill out a survey after a visit. This is electronic, so as soon as you're going out the door, you get a text, and there's 3 questions, and here are the 3 questions. How satisfied are you with your scheduling, your experience? It's 4.8 stars out of 5. How satisfied are you with your appointment? 4.85 out of 5. And how was your overall experience? 4.95. So almost 5 stars we're shooting. We know that folks are truthful. You can't be 5 stars at everything. So terrific start, and we're very elated about that patient experience. We'll go to the next slide. The next slide, and I wanted to show this because I think it's really, truly important. These are folks that are seeing us for health care, and we wanted to track some metrics. Metrics that your insurance carrier tracks, we track internally. But what I did is I separated out those that were part of the Waukesha School District insurance. We're tracking breast, cervical, and colorectal cancers. We know that if you get your annual cancer screenings, you have a better chance of early detection. So that's why we chose that. We also chose managing your patients who have diabetes, hypertension, and well child. The light blue is stretch performance. That means that we're at the 90th percentile. So you can see that for our breast cancer, cervical, and colorectal cancer. I looked back at your 2021 performance overall, and for mammography screening or breast cancer screening, the highest we ever achieved was 87.4% prior to Prohealthcare taking over. We are at 92% now. Cervical screenings were at 50.6%, and we're at 91% now. Colon cancers was at 68%, and we are at 84%. You can just see in the cancer screening alone that we are really knocking it out of the park, and folks are actually adhering to the recommendations of the provider to have those cancer screenings. You'll see a area that's in red, and that's controlling high blood pressure. We have 103 members. This is an annual stat. We're only 9 months in. We actually take the last blood pressure of the year, so we have till 12/31 to satisfy that. And if you do the math, it's just a few people. And then the well child, we have 19 children that we see. 14 are on track. We just really need to get that 1/15th person on track, and that actually swings it to stretch. So strong performance in our majority of our metrics, and we continue to work with our teams on improving the adherence and getting that blood pressure under 140/90 and getting all those children's visits in, especially for their immunizations. We'll go to the next slide. This is a slide that Pete and I look at all the time, and this was really one of those talking points that we had with you when you interviewed us for taking over the clinic, and that was utilizing the UHC network. So PHC is a preferred provider for UHC. They also have a program called Premium Designation. And what you've taught your folks to do is to look for a high-quality provider that's very efficient and premium designated. So when folks come to us and they need a referral or they need a PCP, we refer them 100% to the premium designated. And how have we looked at that across kind of Wisconsin? So PHC recommends the specialty visits and those to the premium designated, but we are the highest in our market for premium designated. That means that we adhere to those rules. That means when you come in to see us and they need to move on to the next level of care, whether it's a primary care or a specialist, we actually send them to premium designated providers. We also are the next person below us. We're actually 20% higher than the person below us. So we are really knocking out of the park of this metric that you guys challenged us on to make sure that we were utilizing that premium designated program. We'll go to the next slide. Affordability. So here's your customer experience or your employees, spouses, dependents. It's $30 to come to the clinic if they have not met their deductible. We have agreed upon services that include the office visit, simple labs, simple radiology. So they just pay $30. That claim is sent to UHC for tracking, so that can be tracked through our payer. If they are coming in for prevention or they've met their deductible, they owe nothing. And we send that claim on to UHC for processing. Then we have bundled pricing for our occupational health, so for all those new employees coming in, anybody that's injured at work, and then our HRA and flu programming. We'll go to the next slide. So we promised the group here that we would work together on ongoing communication and promotion, and the team meets regularly. We were meeting weekly, ongoing huddles. We've now moved that to monthly because we have a really good handle on the program and strong performance. We prepared some content. I know it's small here, but we helped Kristen, who is here tonight, with the website development and helped her with the content. And we also had some what we call promotional items to promote the clinic. And then, like I said, tomorrow we start our HRA program and flu program on site. We actually have providers coming to the clinics, introducing themselves to all of your members and what services we provide. We'll go to the next slide. and I think this is an important slide, and I think your broker is going to talk about this as well. But in the 2021-2022 year, we predicted that we would save the district about $400,000. We actually saved the district $315 and change, but that was due to some overlap in your agreement between your previous vendor and us. That was driven by the school district. And right now, we're pacing at about $574,000 and change in savings through this year. So I think we've met all 4 of the metrics that you outlined, that we would have a program that was accessible, affordable, quality-driven, patient experience, and technologically advanced. So appreciate the time tonight, and we'll take any questions you have.
Just to kind of frame out these savings numbers, the dollars themselves is a big number, but keep in mind, the old clinic, we ran at about $1.1 million, I think. So on a percentage basis, we roughly cut the costs in half, and I think are providing a better service, more locations, Epic, all those things that Vicki mentioned. Kristen, I have to apologize. Another star started working with us on January 1st, because when better to hire a benefits coordinator than the first day of the clinic. Kristen Moroz is truly a real joy to work with in our office. I get more compliments on her from staff, and I agree with working with Vicki's a real joy as well. So, but she's really the contact, and I don't know if Kristen remembers this, but in January, not only do we have a new clinic, new processes, COVID was a hot topic, Prohealthcare was adjusting your protocols, then we would adjust, then we'd have to re-communicate. So Kristen really hit the ground running and has done a fantastic job since January 1st when I stole her from HR. But just a little background information. And then one other thing before I forget, the pharmacy, or lack thereof, with our arrangement with Prohealthcare, we have added and tried to come up with a different solution. Actually, we've had some conversations as well, but we added a drug program through Costco, and it's kind of the ones that Target used to have, the generics, where you can get a refill for $6 for 6 months. So we have tried to come up with a new approach for that as well. But overall, very pleased with where we are with the clinic. So we're here to answer any questions you might have.
Questions? Dr. Pazik?
Thank you. Maybe an easy one. How has participation changed between the 2 years that we're comparing? Is it on par?
Actually, there's more participation number-wise.
Okay.
If we compare apples to apples. Like Darren said, we don't have the dispensary where people would come and get their prescription medications or physical therapy. What we replace that with is just the medical, the HRA, the flu program, and the virtual health. So people are seeing more, I believe, than maybe the previous model.
And the other thing you'll find out is, with my chart and also with ODESA, which is our digital capabilities to communicate with people, when you saw the quality scores, we know exactly the entire population and who has or has not come in for their different screenings and such. That's where we start to pump the information out to those individuals, try to get them in, because the key is you got to get them in early. That's going to save their life potentially, and it's going to save the district a lot of money. That's where we're targeting those people that are highest risk. We want to get a relationship with them and get them engaged. So I think and as Darren said before, we don't count if someone comes and gets a prescription, that's a pretty quick visit. What we're doing is actual provider-facing visits with the employees or their families.
Thank you.
Ms. Kozlowski?
Thank you. I'm still looking at the cost savings, and just from my understanding, what are the cost savings measured against? So what are we saving?
So this is measured against what you were paying to be part of the relationship with the county and the city and the school district. The other thing that's not counted here is by sending more people to the premium designated providers, which are the higher quality, lower cost providers, you have a higher percentage of people going to what United would say is the preferred providers. That isn't even factored in here. That was just the administrative savings that you experienced by going into the relationship.
And these numbers are very close to what we had projected at the time the decision was made. And keep in mind, we changed to ProHealth mid-year. So the savings was kind of, cut in half. So this is exactly where we thought we'd be and providing more care.
Great.
Better locations, better facilities.
Thank you.
And I think that virtual is something that's, you know, your employees and families have embraced that. And by going to midnight now, it's going to be even another thing. We want to keep people out of the ER if they really don't need to be there. This is a way that they can do that. Now, if they need to be there, they need to go. But virtual is being embraced by people all across the country. We're investing a lot of money in the new tools. And I think you'll see even more utilization once people try it. They like it, especially the younger professionals. And if you have a lot of people that live in Tosa or far away, here's the easy way for them to get access, until midnight every day, till the weekend.
Any other questions? No? All righty. Thanks for your time this evening.
You wanted us to stay?
Yeah, if you can just, Jeff, if you want to come up and,
Jeff in the middle here. Hot seat.
because this is all the same conversation, it's different pieces to it. Let's see,
This will be our health insurance report, correct?
Correct.
Yes.
yes.
I think you have a new deck there. Good evening, everybody. It's great to be with you. My name is Jeff Schultz. H and I were grateful for the opportunity to serve you as well, and I've got some, just an update for you as we've closed down our last health plan year and kicked off a new one. I would just give kudos to the district and the ProHealth team. That was not an overnight process. We worked on that for a number of years together, examined a lot of different alternatives, and as we had talked about, primary goals of increased access, overall technology improvements, which will lead to better care, and then a cost reduction. And so it's exciting to see all those four get delivered. So, just the one thing that, this slide here just talks about healthcare strategy. I'm not going to bore you with a lot of healthcare strategy, but, the employer and the employee both have a partnership role, as you can see on both sides there. And what we just did and what we were talking about with the clinic is an upper left where it says squeezing the waste. There's a lot of waste in healthcare, and to the extent that we can squeeze that out and make it efficient, we're gonna reduce cost and improve care. The other thing we're helping employees do on the right-hand side there, we're helping them build a culture of health here at the district, navigate a complicated maze, and give them a better experience when they walk out the door with an app that just asks them basic questions so that we can have a continuous feedback process and improve it. So I'm just going to continue that theme as we walk through a couple of other initiatives that you as the district have embraced. So next frame just talks about the healthcare supply chain. Most people might not realize that there is a supply chain in healthcare, and to the extent that we can control the components of that, address the rising increase in those supply chain components, we can actually reduce healthcare costs. So at the fundamental core of healthcare is cost, or the fundamental cost is driven by price of healthcare and the usage or utilization of healthcare. That's where you see the red circle, and then you've got prescription, inpatient, outpatient, and physician services. The clinic addresses the physician services. Our premium designation addresses the inpatient and outpatient services, and I'm going to touch on the initiative that the school district put into place to address the prescription part of the supply chain. So this is a frame from when we got together of February of 2021. And we sat in front of you and said, of your $22 million overall spend, you're spending close to $3.8 million on prescription drugs alone. And the trajectory of that spend was increasing exponentially at the time. And there's the trend. I won't go into the percentages, but you can see the trend. The dotted line plots that graph. It's a pretty significant trajectory. And, that's not unusual in healthcare, because actually across the country, healthcare utilization's been relatively flat for the last 4 or 5 years, but prescription drug costs have been the thing that's really been a thorn in most employers' sides. So that trend was increasing substantially. So we said, here's what other organizations are doing. They're taking the 1% of prescriptions, which is the second from the right-hand column, which represents 68% of the overall cost, and trying to do something about that very sort of sub-component of their prescription drug costs. And so we made a recommendation. And the recommendation is to work with Navitus on a program that would deliver these drugs to your people at a reduced copay, but determine whether or not we could have someone else finance them. And we said, if this could happen, we believe that there's $1 million a year of that 3.8 on the table to be grabbed. Again, similar to the Prohealthcare discussion, we're not denying people drugs. We're getting them the drugs at actually a lower cost and improving the customer experience. And here's where I would give a lot of credit to the district. You don't operate sitting on your hands. You look at these recommendations and you say, you know what, if this is what innovative organizations are doing, we're going to embrace them. And you've done that over the years. And this is the reason why we can deliver good news, like a 50% reduction in clinic costs and some really remarkable cost savings that I'm going to show with and share with you here. So what happened? Well, you remember that chart, the trajectory of that chart. Look at what's happened 2/3 of the way down. Those costs have absolutely tailed off. And the next chart actually shows the contrast. So that's where we were headed on the left. And we put the program in place, and you can see when it started, and you can see what happened to the cost. In fact, the costs reduced dramatically, and the next frame will, I think, will show you exactly what we're talking about in terms of overall costs.
Just one thing, I think this is the most powerful slide in Jeff's presentation, but I can tell you for 20-some years, I've been hearing about bending the curve, and this is the first graph that I've actually seen bend the curve. So just, I'm taking a mental snapshot because we may not ever have a health insurance meeting like this again, so it's a beautiful thing.
It is a beautiful thing, and I would also say that represents a 32% reduction on a per person per year basis from the peak. So here's what we have. Through March, we had $1 million of savings and change. So our estimated first year savings is going to be way more than $1 million. It's going to be about 1.8 million. And remember, your folks have gotten the exact same drugs they needed, prescribed by their doctor, but somebody else has paid for it. And your people have actually paid lower cost for those drugs. So this is a triple win for sure. So what impact does that have overall? You can't see the percentages down below, but what I can tell you is the last line of that slide reflects an overall 2% cost reduction. So this is when we combine the medical and the RX together, the impact of a 32% reduction on the RX is so significant. And we've had good experience because of the clinic and other things, so that our overall healthcare costs on a per unit basis actually dropped slightly, 2% last year. That's remarkable. It's really remarkable, given now we're in a significantly higher inflationary period than we were 12 months ago. So this is really good news. So that's how we sort of ended the year, and the next frame will show you what that means in real terms. What it means is that we projected about 20 million, just shy of 21 million, and we actually came in slightly under budget for this last year for healthcare. What your decisions around implementing strategies to control the inputs on the healthcare supply chain have a direct impact to the district and its employees. Because when we do things like this and we come in under budget, and if you flip to the next slide, allows us to take the take the budget for next year and really see a flat budget, what that allows us to do is, on the next frame, go into the next plan year with no change in employee premium contributions and no premium changes as well. So because of the good work that you've done around embracing these innovations, we've been able to bend the curve, and that translates into a more affordable and stable benefit plan offering than, quite candidly, your competitors might be able to offer, because they might not be embracing those strategies. So that's all good news.
Keep in mind, I went back to the
Yeah.
previous slide, the board authorizes, now we have reserves, right, in fund balance, and the board authorized the use of $750,000 if needed. If the claims aren't there, there's no cost to us to better ensure, but we wanted to provide a clear picture of where claims could go, so we asked for that, and when you adopt the budget later this month, it won't be budgeted for, but I plan on putting a footnote in the document so it's there for people to see. But also, we talked a lot about structural deficit, and normally in our budget projections, I assume a 5% increase in health insurance. If it's more than that, which it has been historically, it was plan design changes to get us down to a 5% increase, and then we had another discussion if needed. But by going to zero in our structural deficit, the reason I bring it up, 5% on $20 million is a lot of money. So if our funding's staying flat and our health plan stays where it is, we're $1 million in the hole before we've even talked about buses or pay or dental or any of the other things. So to pull off a zero, and I'm hoping we can continue that for a little while, or something very close to that, really takes the pressure off what we've been dealing with lately financially.
And if I could just add about that 750, there's more than ample reserves to do that.
Yeah.
That's a conservative and prudent play, because at some point in time, we may be asked to buy down those reserves.
Yeah, during COVID, we kept waiting for that wave of, hey, I haven't been to the doctor in a year, then it was 2 years, and at this point, I don't know if the wave's ever going to come to be, but we have the reserves to ride that out as well.
So, really good. So again, you got $1 million actual plus 300 from the clinic. We entered the new plan year, which kicked off September 1st with no plan design changes, no employee contribution increases. And as on a go-forward basis, looking to the next 12-month period of time, we should see a $1.8 million cost reduction and even garner a little bit more savings on the clinic to help offset any adverse trends that we would see. And in the spirit of trying to find money and refund that back to the district, one of the services that we just talked about was a claims auditing service. In the past, claims auditing services sort of went like this. You pay an outside firm $30,000, $40,000 a year. They'd take a random sample of your claims. They'd extrapolate that out. They'd try to recover some dollars, and really their goal was to just make up their fee. It really wasn't very worthwhile, and we didn't recommend it. However, your data actually goes through a data analytics program that we utilize, and they've partnered with a company who've come to us and said, you know what, we'll audit every claim. We'll go and make sure there aren't fraud, waste, abuse, and overpayments. And when we find it, and when we go back to the providers and recoup dollars, the employees could get 100% of their recovery. And whatever we recover back to the plan, there's no upfront fee. We'll pass through, and you can see on the right-hand side, we'll pass through 30% of all the recoveries right back to the district. So if they find $50,000 worth of overpayments for the last plan year and they're able to recover those, district will get 30% back. But the numbers that they're talking about are pretty substantial. Just to give you an idea, the initial projection based on all these metrics that we have with the proprietary algorithms and everything else could mean that the district could stand to receive in excess of $75,000 or $85,000 a year because of this claims audit service. And that's your 30%. And it also will run in the background on an ongoing basis as sort of a watchdog for fraud, waste, abuse, and overpayment. And again, the good news is if there's an employee that actually spends more out of their pocket than they should, they're going to get 100% of that back. And they'll never come back and ask for dollars from an employee if they underpaid. So, again, just another innovation to try to tighten up the waste, squeeze the waste out of the system, and then, return some funds to the district. So, thank you. Happy to answer any questions.
Any questions? Dr. Piazek?
Just a clarification, thank you for that update. For the claims auditing that you were just talking about, if there's an underpayment, though, that would actually be reconciled against the overpayments, but not to the employee?
The underpayments would not be reconciled to the employee. It would be reconciled to the plan, correct.
Okay, thank you.
So if there's 100,000 in overpayments and 1,000 of underpayments, net 99.
And is that 30% charged back to the
No.
plan as well? No, 100%?
Yeah,
Yeah.
good question.
So we haven't signed an agreement, we just
No,
started talking about
we
this
just
a
started talking
couple
about
weeks
last-
ago.
Yeah,
I like the approach, because it's 30% of something would you rather have 100% of zero or 30% of something, I guess is the math that we're knocking around, and I like the ongoing part of it. The only other thing I would add to the savings in the prescription drugs is our staff really went along with this, and it's not many people, this is very expensive pharmaceuticals we're talking about, but really bought into it as well, and without them willing to do that, because there is some paperwork and documents that need to be shared in terms of earnings. I don't know if we had hardly, if any, complaints or maybe some just general questions, so they certainly played a part as well.
Excellent. Any other questions? No? Thank you very much for your time.
thank
Great
you.
report.
Appreciate it. Yep. Have a great night.
You as well.
Take care. Thank you.
Alrighty, next up on our discussion information agenda is the HVAC update.
Hello again.
Welcome.
We're back.
Yes, we're back. So we started in early 2021, right, with our ring and do high-level district report, and 2 months ago we brought on RTM as our engineer to narrow that down. Last month we had Total Mechanical, our design assist contractor that started getting into the buildings. And so today's update really is just with Total Mechanical getting to the buildings and working through to a finer level of detail into our priority 1 projects. Today's update is just to really bring this group up to date, have some discussion, and then next month we're looking to, depending where the discussion goes, either have everything put together as a phase 1 package and say we approve, let's go forward and proceed, or at the very least we want to have the components, the long lead time items for next month for the F&F committee to recommend to the board to make a final for those components, and then the following month then would be everything put together. So what Total Mechanical, since last month getting them selected, we focused on our phase 1 projects. Again, phase 1 was Hawthorne Elementary, Hillcrest Elementary, Bethesda, Lowell, and Prairie was our last one. So those were our priority or phase 1 projects that we started with. So Total Mechanical, along with Joe and RTM, had several meetings, went out and looked at the individual sites and the individual components within, and then Total started putting budgets together. And so what we're going to be talking through is just some of those budgets. Along with that, put some other options out there. So we'll have some additional options to discuss in today's review as well. And then with going through that, the phase one portions and projects, which we knew that was a variable was lead times, right? So with some of these lead times that are out there, biggest one being electrical switchgear, so some of the buildings, Lowell, Hawthorne, and Prairie, getting updated cooling requires electrical switchgear updates. And it blows me away. It just keeps getting long. I thought it was getting better with lead times, but it's 72 to 80 weeks out for electrical switchgear is what they're telling us right now. And so because of that, we kind of reshuffled where phase one, phase two could be. And that's where, at the end of this presentation, the discussion I'm hoping that the committee has is just talking through the phase one and phase two, if it makes sense how we're presenting it, or so my presentation is going to be talking through phase one, but since some of this work is dependent on electrical switchgear, that's 72 to 80 weeks out.
Yeah, to provide scale, we're talking delivery in June of '24.
Right.
So
right. And
it's a ways.
so since some of that is so far out, this scenario would be, let's potentially take and move some of those components into a phase two, since we're waiting so long, but we still would need to pull the trigger November, December, somewhere around there. December, I think if we said, yes, let's do phase two projects, we'd still get it for the summer of 2024. So just want to talk through that. And really, at the end, the discussion we're looking for and how we started this journey was when we identified dollars and ESSER funds. It was the number of around 10 million was thrown out. Let's break that down into smaller pieces so we can make decisions. So we broke it down into a phase one, which we identified about 5.5 to 6 million for phase one, and then allow the committee to make a decision if we want to proceed with phase two as well. So at the end of this, I think that's where I'm hoping just to hear feedback as far as do we want to do phase one and stop at that, or do we want to look at phase two and potentially look at that in the next couple months of saying, yes, let's proceed with that phase two and commit those kind of dollars between the ESSER dollars and some operational. And the reason I think that discussion is important is if the committee says, no, let's just stick with our original phase one plan and let's worry about phase two at a future date. I think what I've done here with this phase one was we looked at pulling in some previously allocated phase two projects and moving them to phase one so we can do some of that, targeting that 5.5 to 6 million, doing that this summer. All right, so I think that makes sense yet if the overall idea of a $10 million plus or minus for phase one and two is likely to happen. If the committee says no, let's just take care of phase one, the highest priority stuff, then maybe the idea of bringing one of the phase two projects forward into phase one, maybe that doesn't make sense. So I'll walk through, in the one project that we're looking at pulling forward from phase two was the North High School control upgrades and air handlers. So on the screen, we'll walk through phase one based on modifications from this last month's worth of work. And so some of the modifications, again, was lead times. And then the second piece was as Total Mechanical and Joe worked through things, they provided some additional options of if you're in this space and in this school, it may make sense to do some additional work that wasn't part of the original priorities. So I highlighted those in red as we go through this. So Bethesda we'll start with. Air Handler 3 and 4 was on the initial phase one projects, and then control upgrades for those main units. The recommendation after working through this is rather than just replacing Air Handler 3 and 6 in its entirety, let's hit all the air handlers, but instead of replacing them, let's do a retrofit, a refurbishment. So basically what that is you're leaving the box, the air handler, think of the air handler as a big plenum box that is moving air through it. You leave the box as it is, but you're replacing the interior components of it, the coils, the fan, the motor, the dampers, everything that makes it go. And so in this example, we're able to do, rather than just the 2 air handlers, 3 and 6, we're able to do 1, 2, 3, 4, 5, 6, and 7, do all those units at Bethesda for about the same cost you can replace just those two air handlers for. They're all about the same age. The reason number 3 and 6 were put on the priority list, again, kind of where we started this thing was prioritize, if we had a fixed dollar amount, what are the units across the district that make sense in the highest priorities? Well, number 3 and 6 were in the worst condition, but the rest of them are all about the same age. So the recommendation on Bethesda is to do a refurbishment of air handler 1 through 7, and that's $370. Move on to Hillcrest.
Should we talk a little bit about the building challenges?
Yes.
The space, where these are, and some of those other things to help frame that
Yep.
decision as
No,
well.
that's a great point, which went into the recommendation to do the refurbishment as well. So when you replace air handler 3 and 6, you need to rip the structure off the roof and the roof off in that area to get these units out. So you're spending money not only on the units themselves, but you're spending money on removing the roof, removing the structure at that point, and re-putting it back in. So if you get to Bethesda or familiar with that, there's in a number of the different classrooms, this one of these classrooms that I went up in, it's a ladder. You go into the classroom, or I think it's a specials room. You climb up a ladder, and there's a 3-foot by 4-foot hatch, would you say? Yes. You climb through there, and then when you get in there, that's where the air handler unit is, right? So obviously this big box isn't going to get through that 3-foot by 4-foot. When they built the building, they set the box in place, put the built the roof on that. So that's one of the reasons Bethesda is being recommended for the.
They wouldn't get the big box out or the new one in without the roof being.
Right.
So that's.
Right, so when you bring in like coils and the other pieces, you won't need to go through that level of removal and replacement as far as the roof. So Bethesda's the roof. One of the other ones is a wall that would come out.
So before we go really granular on what it takes, so when we met last month to talk through this, right, so we've kind of taken the approval to this in phases. So the dollar amount really hasn't changed, correct, from where we said. We knew what the range was going to be. We knew that they had to come in and make recommendations. We were also very aware that we were facing supply change. And with that, we knew that the decisions were going to have to be made to pivot, right? So based on what we know with supply chain holds, this is exactly what you had kind of expected us. And so the questions now are really, we've approved moving forward with what we need. How and the timing of what we need to do that has changed because of that. And so am I missing additional pieces in here on all of that? Or is this really just hey, based on this, we're asking to restructure initially what was in phase 1 and phase 2?
I guess I look at this conversation at this point as a reconciliation from the recommendations, the original recommendations, to what we're recommending here tonight. And once we got into the buildings, there was challenges on the size of the room, and the new equipment wouldn't allow us to have any room to access the equipment. So we're really just trying to walk you through, because you could get questions, especially the items now that are 2A because of the supply chain. If they read the original document, and I forget what schools are on there off the top of my head, why aren't we being done? So we just thought we'd walk you through, but if you're comfortable, because we are within the dollar range, phase 1 comes in at just under $6 million. So that part of it's all the same. But we thought you should know that we did end up doing some of that shuffling, because we knew this conversation would mature over time as we dug more into it. And then I guess the other question that we talked about maybe happening, we're at that point where phase 2A, I guess, we don't need that decision tonight. Do you want us to keep do you have questions about it? And we can come back to you next month and say, here's 2A, because you need to start ordering. You know, if we wait till June of this year, 2A will not be installed from what we're hearing now in '24. So those were kind of the highlights I think we wanted to pretty much hit on. The dollars are all within our earlier conversations.
Dr. Piazza?
Thank you. Thank you for getting creative with the approach to this. When I look at 2B, I know we're not talking about that yet, but there's probably another $2.5 million worth of work to be done. So I guess I have some questions. What is the time frame to draw on the ESSER 2? Is that 2024?
Next September 2023, end of September of '23 for ESSER 2, and then September of '24 for ESSER 3. And this would, Phase 1 would fully expend, we have ESSER later on in the agenda. Phase 1 of this would completely spend ESSER 2, enroll some dollars into ESSER 3. I think we end up, if Phase 1's approved, we'd still have just over $7 million, I think, left in ESSER authority, all in 3.
It feels like this, it does keep expanding a bit, and the longer we kind of go, it's going to keep expanding. And we can continue to make Phase 1 and 2A a $9 to $10 million plan, and then 2B continues to grow into
It's a living
$3-4
conversation.
million dollar plan. And I can't help but notice that South High School continues to be in Phase 2B. So I feel like we're either in this or we're not. Does it help to make these decisions up front? Or,
Well, does it? So what does the money look like? So if we're out 80 weeks
Yeah.
and we order a unit today, I find it hard to believe that they're going to be the same price 80 weeks out.
So,
At 8% inflation a month, plus the labor cost, which is 80% of the job, is going to be different 80 weeks out. I mean, I understand a switchgear is just a, surge protector on steroids. So what does that look like? If we have anything from these manufacturers, and I don't know who the manufacturer is, obviously, because we haven't seen the list, but, I mean, what is the cost increase going to be if they can't get that? And I'm counting on 80 weeks. Just to the backlog of building in New York that uses these switchgears. I mean, just the hospitals that they're building that use these things. Do we have any sense of what that cost is going to be? Because they're not going to eat, that inflationary cost over the next 80 weeks. I can guarantee it, they're not.
yeah, so these numbers are all based on the schematic design that was put out. And so Total Mechanical is putting right now these are our budgets, right? So
Right.
So we're not saying this is the dollar amount, there's contingencies in here, right? And so between now and next month, if the plan was if North High School doesn't get added to this,
Right.
between now and next month, then that's what's getting bid out. So
Yeah.
that's some of the feedback I want to hear from this group is okay, yes, if Phase 1 looks good, with or without North High School in it, then the rest of the design gets completed, bid out, and when they're bidding, when the electrical
Yep.
contractor's bidding that switchgear,
Yes.
they know that it's not going to come for 80 weeks or 72 weeks, right? And so they're going to bid based on what
Based
their
on what
labor
that
rates
is.
are going to be.
Are we expecting any cost overruns? Is going to be more? So, like, say we approved $9 million. Obviously, we're going to have to add to that if our equipment's not coming in for 80 weeks. Do we know what that is?
So
I mean,
these-
just the labor and the equipment price is going to be
Right.
higher.
So these budgets that Total Mechanical provided for us.
Yes.
Should be capturing all that.
Okay.
Next month, when we come back, of saying, okay, here's our final numbers, for if it's either we're gonna come back with the whole package put together, depending
Right.
on kind of the discussion today, or we're gonna come back and say, okay, we're ready to purchase these long lead time items, the
Yep.
actual switchgear itself, and release those things, and then the following month we'd come back for those. But those then, that's that guaranteed maximum price that will be coming back based on the full design. Right now, the project hasn't been fully designed, it's been, here's what it looks
Yep.
like, and in order to make decisions, right?
Okay.
If we got to pivot, then we don't want to design on something that.
Right. So when they do the final bid out on the design, it could be more than we approved. Right? For the scope that we want. Say we want to do 12 buildings or 10 buildings or whatever, and it's $9 million. When the final design is bid out, is costed out, essentially, because they're going to give us a cost, because we're going with them. So the bid, it's not a bid. They're going to tell us what it's going to cost. We could have an overrun on that cost, correct?
It could.
It could happen
Yep.
just because of the unknown of where we're going to get this equipment.
Yeah.
Because I think that there's some places in this country that are going to get a delivery before the Waukesha School District. I just think there is. You know what I mean? So I was wondering, do we have a contingency, say that we have $1 million cost overrun, which is conceivable in the world we're in right now. Are we cutting to get into that 9 million? I don't know. That's the only thing. 80 weeks is a long time. And a lot of things happen in 80 weeks. I mean, we've been dealing with CPI for 2 years now, panicking about employee costs. These costs, an electrician that costs a lot more than a teacher. So this is going to be, could possibly be serious money 80 weeks out. I don't know.
Right.
What our contingency plans is if it comes in over the 9, like Kelly was saying, all in, well, all in could be 10 million instead of 9.
If that happens, and I think anything's possible.
Yep.
Right? It's kind of a strange time. This is why we have set aside a lot of one-time money in fund balance, is to deal with the
Okay.
unknown, right? And it's the perfect, this would be a one-time expenditure for this cluster of projects. We've also set aside funds in Fund 41 in fund balance for long-term maintenance. Now, ideally, that was going to be used, this was going to free up dollars to be used on other projects that we have out there. So I do think we're in a position today to take on,
Okay.
an inflationary impact on these projects. In terms of doing more projects, one thing else about the phases is we only can design so many projects. It's a very time-consuming process. And I also thought it would be good to bring it in phase by phase, because I don't want you to make a decision on this one, and then 3 weeks later, TNL or fill-in-the-blank department has something else that's out there. So I really want to give us time to make sure we end up with the best final usage of the ESSER dollars. Joe Hines, our HVAC guy, and I, and Kurt, who knows our buildings very well at this point, I'd love to have Phase 1 and 2A ready to go. And maybe operationally, we could get down into high school, South High School a lot quicker, because all these other ones are being funded. But it's really, it's your comfort level. I thought breaking it down into pieces would be the best way for you to, and I kind of like it if next month Phase 1's a go. 2A is just sitting here, ready to roll. And we could even have information on 2B for like a December approval. And then it'd be just mapping out, when are we going to get the stuff? What summer is it going to fall in?
Are we adding anything to Phase 1? Because we have 2 buildings that are vacant right now that are not going to be vacant shortly. Do we have to include those 2 buildings in Phase 1? Is there anything that we need done at those buildings? I noticed that one of the footnotes in here was Whittier is vacant in the bottom.
Yeah, that was
General notes, but now it no longer is going to be.
Yeah, we have no plans to do any HVAC work at Whittier at this point.
Okay.
For this summer, because I just don't think it could happen.
Okay.
Design-wise and
Right.
everything. We did talk about it, we had a call this morning, and we did talk about whether that moves up into a 2A or not. The 2A and 2B, to me, is going to be kind of revisited based on what bid results we get and other things. But there's nothing we need to do it. Blair, we talked about today. We have 12-month staff. We talked about, could we bring AC to that building, which I think in time would be beneficial cost-wise. But we decided we'll just do window air conditioning units this for summer, because we just don't have the time to get out into the marketplace and secure the equipment. It's just not going to happen for this summer. But we have, and it is a growing list. These buildings are living
Right.
facilities, and the costs shift and the demands on our budget dollars for maintenance are constantly changing
Yeah.
as well.
Okay. All right.
So we can continue to march through. I think the nice thing I like about the handout that Kurt put together is the red is what we've changed. So you can clearly see, and for anyone who's looking at this and has an interest in our 2A buildings, those are really changes, and we talked about it, but I want to make sure it's clear. It's supply chain. We can't enter into a school year without knowing the equipment's going to be in place, and in the case of the 80 weeks, it's no way it's happening this summer. I mean, there's just no physical way that that's going to occur.
So Lowell is one of those that get it's in phase one yet. That is one that gets an electric service upgrade.
Yep.
The reason that stayed in phase one is they feel they can get everything complete, basically all the condensers in place, and they just won't be able to put that final connection in until that electric service upgrade. But the airflow and all those benefits you'll get after this first summer. So we were able to keep Lowell into phase one, even though that has an electric service upgrade. The final upgrade wouldn't happen until the second summer. You'll get use out of the improved air circulation, but won't get the actual cooling until that next summer. Whereas Hawthorne and Prairie, they could do, if you said, okay, let's proceed with both 1 and 2A over the next couple months, they could get some work started at both those buildings, but the majority of that work wouldn't happen until next summer when the switchgear came in.
So Lowell needs a service upgrade?
It does, yes.
How much more power are you bringing in?
I'm not sure what the size of power, but it's triggered because of the additional cooling that's
cooling
needed.
load.
Yeah, so it's Lowell, Prairie, and Hawthorne are the three buildings that are requiring an electric service upgrade.
Oh, okay.
To handle the additional cooling load that we're adding to those buildings.
Okay.
And then North High School, the reason that's blue, that's one because we're pulling that one forward. That number needs to get validated. So again, if the committee likes that direction of, okay, let's bring another project in to stick with the overall plan of the 5.5 to 6 million for this first phase, if you guys like that idea, then that number needs. These other numbers have been validated, right, with total mechanical. This was, when we got the budget this last week, it was, okay, how can we, what's something we can do to keep that 5.5 to 6 million? So that North High School, we'd come back next month with more accurate numbers. And as I said in the last meeting, with the complexities of these projects, that's why we're bringing it piece by piece as we're learning information, just to keep the committee informed and comfortable with the process that we're using.
And ultimately, next month, we'll be bringing forth, it'll be agendized as it is, and whatever motion you want to make at that time with the refined numbers, we can respond accordingly. But we just want everyone to know what the cards are being dealt right now in terms of supply chain and everything else. So.
Yeah.
And maybe that improves. Maybe not. I don't know.
So what do we need the switchgears for? What projects?
So it's Lowell.
It's Lowell? Is anything, it's anything with a service upgrade?
Right.
Okay.
So Lowell, Hawthorne, and Prairie are the three.
Okay, so we need 3 of them.
Right.
Okay.
And the phase 2 projects, none of those have cooling associated with, so that should be it
Right.
as far as the switchgear lead times. That's the longest of the lead times. There's
Oh,
also, if it's on the footnote, there's 24 to 32 weeks for condensers, fan walls
Yeah.
30 to 42 weeks, rooftop units 24 to 36. So there's other components that we're keeping on radars, and we're still good with this next summer with those other ones, but it gets us tighter. So.
Do you know who the manufacturer of the switchgears are?
I'm not. I don't, and that piece hasn't been bid out. So that to your earlier question, that switchgear components would actually get bid out, because that's a subcontractor of Total Mechanical.
Okay.
So that's a piece where engineers got to finish that design. If the direction is, okay, keep going, finish design, get it bid out, bring it back, at the very least, though, that component, to release that for next month.
Right, so Total Mechanical is gonna, whatever the electrical sub is gonna bid it out to Total Mechanical, not us.
Correct.
Right, because they're the umbrella.
Right, yeah,
Right,
and
okay.
along with those different electrical suppliers as
Right.
well.
Okay.
Yeah.
And the pool air handler, is that, include the dehumidification? Are we increasing dehumidification on that? Are we having some issue in there?
We recommended the pool air handling unit.
Right.
That particular unit does have means of dehumidification, but it's in pretty rough shape.
Right, that's what, yeah, because we're having a problem with the dehumidification in north, right?
Yep.
Yep.
Earlier on, I feel like we've kind of solved some of it. We have cleaned the ductwork and air intake on that particular unit, but it's still on borrowed time.
Right, okay. Any other questions? Any thoughts? It's a lot. So,
I could add one thing.
yes, for sure.
North High School, we kind of picked on that a little bit
Yep.
because from all respect that digital control it's the lightest building out of the high schools. It doesn't have as much digital control. It's all on pneumatics.
Yeah, is it still pneumatics? Okay,
So we kind of wanted to bring that kind of up to speed down.
yeah, no, definitely. Yes, Dr. Piazza.
I do have kind of one final thought, I guess, on this. I think if we're gonna, again, if we're gonna go down this path, it's important that we do all of it. And we have a plan to do all of it. And we're facing the inflation that we're facing and kind of the uncertainty about component availability. I think we need, we're talking, a couple boards from now. So I think with respect to the ESSER dollars, the fund balance and things that we potentially have available to put behind this, I just want to make sure that we come up with a strategy to protect those resources so that we're not shortchanging the schools that are strategically farther down the list, so.
So what I can do for next month is bring forth a $6 million financing plan, which is essentially ESSER, but bring in a $10 million just to kind of circle back to where we started and say this is what it would look like if we wanted to proceed down that path. That way you have the option, you can see where the dollars are. Ideally, inflation will slow down and the cost of doing nothing won't be so expensive, but there is a true cost to that right now.
Yeah, and wage inflation is not going away. I mean, you're not going to tell a steam fitter that he's going
We're
to
not
make
going
$90,
backwards.
right?
Oh.
In 2 years, he's not going to make $90 when he's making $100 an hour. It's not going to happen. It's only going up. So, yes, Mrs. Kozlowski.
Thank you. So I think for what you're asking for, right, I think that from our standpoint, we're behind the path that you guys are on. What I would say is that we need to keep going. I appreciate the transparency and changes because I think we're pivoting, and I think we're going to continue to have to make changes in how and what phase goes where based on supply chain. So from that standpoint, with Darren's kind of giving us the carve-out to ensure that the funding is there set for us, knowing that we have delays, keeping us transparent on how things are moving, but I think we're in line with the approach that you guys are doing.
That's helpful.
Thank you.
Yeah, I would agree. Any other? Alrighty.
Great.
Well, thank you very much.
Thank you. We'll see you next month.
Yes, you will. Looking forward to it. A lot of work. Thank you. Alrighty. Next up on discussion information items is the budget update.
Okay, well, we
Hey,
as we're working to bring a finalized budget on October 26th, I believe, is the date of the meeting. 2 weeks, actually, 2 weeks from today, so not the 20.
No, it's the 24th.
24th, excuse me. Monday night. We keep getting, at this time of year, we get more pieces to the puzzle, and we can continue to build it in. So we're here to just talk about where we're at today. You have your 3 scenarios, and the last scenario is included in the July 1st aid estimate. Originally, we had put in there no change in state aid, but the likelihood is that we would be getting the July 1st estimate, which was an increase from the previous year in state aid. We'll find that out Friday, because that's when that piece of the puzzle will come through. It's normally October 15th, but they will give it to us on Friday because the 15th is a Saturday. But here's the pieces we know so far. We know our equalization value, the EAV, has been finalized, and it's a massive increase of 12.74%. What that does is it helps bring the levy down because it gets spread out over higher dollars. Computer aid, small increase of $3,188. That total is $485,226. Personal property aid, again, is increased very slightly to a value of $622,299. Those pieces fall in because they're considered state aid, and they come into the revenue limit, and those 2 pieces plus our state equalization aid come off our revenue limit as far as what we can tax. So those are important pieces. Refunded, rescinded taxes adjustment, that's just where we know that's $10,114. That just says we had to pay out more taxes that when the county goes through and looks at people that haven't paid. And so we get to recoup that as part of our revenue limit. Our final enrollment numbers from our third Friday count, our ADM, which is for the base memberment, average daily membership, is we are down this year by 204 FTEs. So we continue to have declining enrollment and hold harmless exemptions added to our final revenue limit. On the pieces we're still waiting for are the school choice pupil adjustment numbers. We had estimated, let's see, was it 10% increase? Yeah, we estimated a 10% increase. We're still waiting to hear the final numbers for that. Our transfer service needs to be finalized, and then the state equalization aid, which we, like you just said, will be coming in Friday. We expect to have all the final pieces in place hopefully by Friday so that we can start to build the final budget book, which will be presented on the 24th. Any questions on some of the higher points? Like I said, this brings our levy figure down to 5.99 versus 7.5 last year, and a lot of that is due to the equalized value increasing so much, but also because of the increase in state aid.
There's also a line right in the middle of the page, the $3.5 million. That's our loss in revenue authority from last year.
Mm-hmm.
A true reduction. I think during our budget conversations, we were estimating 3.4 or something, so we were very close to that. But as Sherry said, the EAV is growing up almost 13%, which helps us out with the tax. I think what's unique about this is you're actually looking at a sizable levy reduction potentially. Again, we don't know until the 8th. I think we have the bookends pretty well. Either we're getting the July 1 estimate or our conservative one, but our levy could increase 8 to 10% from the prior year, which is not usual, or not what you're normally seeing.
And this does include defeasance of our debt to the point that we can, at this point, to put that money aside so that we're at a point where we can't immediately pay down the debt, but we can put it aside and be ready to pay down the debt when it's callable. So we are defeasing what is reasonable at this point to make that happen. And that is included in this levy, or this recommended approach.
Any questions about the budget?
Go ahead.
I just have a really quick one on the third Friday enrollment, or the total number of FTEs. Was that what you had modeled? Trying to remember what number you had
It
used.
was very close. Summer school was down, I guess probably that was a bigger surprise, but a lot of that was staffing.
Yeah.
It wasn't, I don't think it was a demand thing as much as.
No, they had to turn students away. There was a wait list for summer school this year because they were unable to staff. There weren't enough of people willing to teach summer school this year, which is a concern when we can't provide the service to everybody who wants it.
So here's our actual enrollment numbers. This is the left, if you're looking at the revenue limit calculation, which is in board docs for you. You can see, but the one thing, I just ran the numbers today because I found it curious. In 2019, that upper left-hand corner, the yellow there, we had 12,049 ADM, or full-time equivalents, I guess. That will fall off for next year. And even if our fall of '23 count stays flat with this year's, we're still going to lose 50 kids right out of the gate because we're losing those high-end years. So I don't think next year our projections wouldn't show it'll be flat, but 50 before we've changed it all. So I thought that was an important number to share. There's a lot of information in here, and actually I wrote down in November kind of doing a revenue limit analysis, because one of the things that Sherry said, the information still has to come. And I don't know if you remember, but maybe it was one of our workshops, I talked about the net revenue limit. Like all this school choice stuff, this will come in more than likely higher than these numbers, but there's a matching expenditure that we have to budget, so it's really a net zero for us. We're essentially doing DPI's accounting in my mind. So in November, I really want us to take another look at that net, because school choice authority isn't helping us balance our budget. So, but otherwise, I think we have, it comes with a cost, but we have a great tax story to tell this year. We're just losing $3.5 million of revenue limit authority in an era of 8% inflation. So.
Any other questions about the budget?
And where that was 12,000, that was 13,000 5 or 6 years ago, just
Yeah.
to give you some perspective.
Okay. Thank you very much, Sherry. Moving on. Next up is, under discussion information items, is the tax incremental funding, TIF number 31.
Yeah, we had a joint review board meeting last week, maybe it was late previous week, about the city requesting the creation of a new TID or TIF, number 31. And so we put it on here because right now I'm the joint review board rep for the school district, but would like to get some feedback if you have any interest or questions that you'd like me to ask or concerns that I could forward to the full joint review board, which we are set to meet in the not too, I think it was early November. So I don't know if you want me to walk you through the design. In the project document, it shows you the map. It's on the north side of town, across from the Fox River. Was it Eaton that was in there?
It's the old Eaton plant? Is that what it is?
Well, it was Cooper Power.
RT&E it used to be,
Yeah.
when I was a kid.
Several
Yeah.
things, but that building's now sitting empty. And just so everyone's clear, unlike the other members of the joint review board where valuation drives their revenue, and I'm not an expert in how the city or county or tech school works, but we're guaranteed the amount that's calculated in our revenue limit, regardless of half the town's a TIF or none of the town's a TIF, we're going to generate the number that the calculation provides. So we have a different viewpoint, in the baseball field discussion on TIF 14 was probably the last time that really came up. But from a financial standpoint, it doesn't impact, I guess, is our only point. The only time we really get into, in TIF 14 on Sunset, where they talked about the baseball diamond, we were talking about the end of a TIF and the defeasance of the dollars, then we do have a financial role to play there, because it's divvied out on the percentage of the taxing authorities. So if you have any questions Or if you wanted to discuss who wants to be the joint review board rep for the district, I'm fine doing it, but since we're talking TIFs, I thought I would throw that out there.
But Mr. Como used to do that, didn't he?
Yes, he did.
Any questions about TIF number 31? Dr. Behazek,
Thank you.
there you go.
Darren, when was the last time you had a discussion on a TIF proposal? When was the last one?
For the creation of one, I think the last one I had was an amendment to a TIF, and it was for the condos, or, where the farmer's market is, that area around City Hall kind of was the last one, and that was probably
Yeah.
a couple years ago. We have an annual report where the city covers all the TIFs, and I've shared that with you, but I think that was the last time we talked about a change in a TIF. And probably before that might have been the TIF to create and build City Hall in that area, going way back, but I'm not sure on that.
Do you remember the sizes of those requests offhand?
No, not off the top of my head, no. I can share with you the last annual report. I sent it out via email, if that would be helpful.
I mean, this seems quite small to be going through the process of TIF.
It's the smallest I've seen.
Yeah.
I don't.
I don't understand why this is necessary.
I don't either. One of the last TIFs that we dealt with was they're going to do a little TIF with the Mendiola Fields. Remember?
Mhm.
City-owned property, which
Yep.
doesn't really pay property taxes, so tax incremental fine.
And that was
Yeah, probably 4 years ago.
4 or 5 years ago.
Yeah.
That was TIF 14.
Yeah. Was that 14?
It was the amendment,
It
remember?
was the amendment, and then we said no, and then they wanted to maybe and then the parking lot next to, wherever the City Hall is, that was going to be.
And that was an amendment as well.
Yes, that was an amendment as well.
That was right about the time I started hanging out with all of you on weeknights.
I mean, I've had some questions about the TIFs. I know you have too, Darren.
Yep.
So I question this one as well.
I'm done.
Okay. Has there been any discussion around it at the meeting?
They just reviewed
They didn't.
the scope, and there was some general questions asked.
Okay.
They go through their, was it but-for analysis and
Yes.
or if-then analysis or whatever. But again, through the financial lens, there's no impact to us as a school district, but I do think there's larger considerations than that, or can be.
Mm-hmm.
So if you have guidance on how you'd like me to vote, or you can share it with me after the meeting, if you want to email me your thoughts, if you want to give it some time.
Just seems that this approach to development is intended for bigger projects that are out of financial reach. And,
Yeah, like the shops at Fox River.
right, I just don't understand why we're spending time on this. That's my opinion.
I can share that question with them. Or if you'd like, we could have, it'll probably be Jennifer from the city. She's joined us before via, might have been during COVID, I think it was a WebEx, to answer that question as well, if you'd like. I could do it at next month's meeting.
So you have to make a decision on this by November
I believe
3rd?
it's after, well, wait. Maybe it is right before our November meeting.
It is.
Is it? I think it was the third
Yeah.
date I have in my head, but
Yeah, it's early November.
So
I could also ask that that be scheduled after our F&F meeting.
well,
Yeah, I mean, I don't disagree with you.
I think this is a topic that not everyone on the board has seen before and will understand kind of the basis of how this works and what it means or doesn't mean for us, but I also, given the size of it, I just don't know that it's worth bringing everybody into that deep conversation. I mean, the amount of value and tax revenue that's generating off of this it's not making sense to me, why we're going down this path, why the city's going down this path.
I can forward the city this question and get at least a written response.
That would be helpful, yeah.
Okay.
So just a quick question about the TIFs in the area. The White Rock TIFs that's still up and running, is the old International Harvester plant, Navistar, is that in that TIF that's being ripped down? Do you know?
I believe that's the same TIF.
It's the same TIF? Okay.
Or is there one that wraps?
I don't know, that's why, I was just
North side
wondering, because I know
bridge?
that,
Yeah, what I'll do is I'll email out,
it would be nice, you know, it'd be nice is to get a list of TIFs to all the people on the F and F.
yeah, I'll email you the annual report.
Okay.
And we do have TIFs in other than the city. The village has
Yep.
one, and the town has the corners and across the street from the corners.
Yep.
As well, but I'll send out the latest annual reports we had.
Yeah.
It's a good list.
And a map would be fantastic,
Yeah.
because we're in the TIF out in the town, the corners, right? Are we in that TIF? With
Pleasant Hill is in that TIF.
Yes. And is White Rock in the TIF at the White Rock? The one,
White Rock's in the TIF, but I think it's the one that heads towards downtown, if I
Okay.
remember in the map right.
it'd just be interesting to know our properties, because this was in a TIF, this building
Correct.
was.
Yep.
Is that TIF still?
I believe that's an active
Is it an active
TIF
TIF?
as well.
All right. Yeah,
Just so people know, a TIF can last 30 years,
Yes.
and even then you can have extensions, and there's a whole nuance to it that,
it'd probably be a good idea to get some people up to speed on the board about where we are with that for sure, because there's a lot going on in there, and it's gone through a lot of reps over the years.
so I'll email that out.
That'd be great. So what do you think, try to get that vote pushed off until after?
I'll try to get a written response
Okay.
earlier, and then I'll send that out probably in an update or something, then
Okay.
look for guidance on whether you want to agendize it next month or not. Maybe
Okay.
you're satisfied with the answer,
Okay.
or maybe you want some more feedback on it.
All right. Excellent.
Thank you.
Any other discussion on TIF 31? Alrighty, next up on the discussion information items is the monthly budget report.
Since we're still in the process of budget development, I'm just going to point out some things that might look a little odd on the budget report, just so that you're aware. For example, interest rates have been very favorable for us, and we're already ahead of budget on what we expected to collect, especially as compared to last year. So in our final budget, we'll be adjusting that and evaluating that and adding that revenue in. Our collections for school fees and textbooks are coming in nice and steady, which is good. For aid, we have our equalization aid, which is normal in September, is our first payment, so that's a good thing. So for expenses, salaries and benefits, our salaries look good, benefits look low, but that's because we haven't booked some retirement, early retirement money that has to be booked yet. So that'll be on there for next month, so that will be caught up. But that should be about $600,000, which will bring us back into the range of where we should be for benefits. Purchase services, there shows a large expenditure for pupil transportation in September, but what happened is First Student was a little bit behind on their billing, and so we did not get May or June bills until September from last fiscal year. So we pay them out of this fiscal year, but we book them back as a payable. So they went in, and now they'll be reversed out of this year. So it's kind of a convoluted thing, but for this month, they're showing as an expenditure, but they will be backed out of this year's because they've been booked back to last year. Let's see, textbooks and non-capital objects, we did have some large textbook spends that make us look like we're already over budget, but part of the original budget didn't have the ESSER monies in there, so as finalizing the budget, we'll be adding in the ESSER budget, which includes some of these textbook fees, so that will bring that back down into line. That's about it for Fund 10, as far as things that I felt looked like anomalies. For Fund 27, really no revenue, but I'd like to just explain a little bit about our Fund 27, our special education revenue. It really comes from four pockets. We have our categorical aid from the state, we have grants, and we have Medicaid reimbursement, plus then we have our general fund transfer. Our categorical aid doesn't start coming in until November. For grants and Medicare, it's based on expenditures, and so we just finalized September expenditures. Those claims will come in for October. We'll probably receive payments in November. So we really don't, and then the transfer from the general fund doesn't happen until the end of the year when we look where we're at. So it's not unusual to have no revenue for special education until November. The only other thing is to point out is that the purchase services is the same thing with pupil transportation, because some of that was Fund 10 and some of it was the special education transportation. So it's kind of simple, but I just wanted to point out, like I said, some of the things that might cause questions. We'll start adding back in next month the health insurance report, and then once we get the tax levy, we'll complete a tax levy report that'll be added. Probably we'll see that in November. Any questions?
I have one question, Sherry, actually, because you mentioned summer school, and it's down quite a bit here in our expenses. Is that because we didn't have, I mean, it's down almost $70,000 in okay.
Yep, couldn't hire the staff to make that happen.
Okay. So it's down about 25%. Does that mean that we had 25% less offerings, or I think it was at 74? The other question I have is summer school on the 22-23?
Summer
Budget?
school is a unique thing because it kind of runs on a calendar year, but for the purposes of the salaries, it comes out of 22-23.
Okay, that's what I thought. So it's down quite a bit.
Yeah, and I would say, let's see, I'm trying to think, we had 307 students last year, or FTEs, sorry, not students.
Right.
And we are down to 265 or 267
Oh,
this
okay.
year, so it seems pretty close to.
Yeah.
Had a lot to do with it.
Yep, okay. Thank you.
If there's no other questions, I'm going to put in a quick plug for something. We're going to RFP for food service for next year for our renewal of our contract, and we're releasing November 1st, and if any board members would like to be on the evaluation committee for the food service RFP, we'd love to have you, so.
Okay.
Did you just validate?
All right, any other questions about the budget report, the monthly budget report? Okay, the final item for discussion information this evening is the ESSER update.
Yeah, we have our trial balance in there, and then there's a graph of the breakout, but if you just look at the trial balance, there's some lines that are shaded blue, and that was kind of waiting on that HVAC decision, but I thought I should show you what that would look like. So we'd end up with $7.25 million left. We've also have, there was some teaching and learning stuff approved last year. Remember, you wanted to break it down into two pieces. So the ones that are marked assigned is that information, or those amounts. I have to talk with TNL. I don't know when they're looking for that approval, but I'm assuming that would come through here because of the financial, I can't remember how we did it last year, to be honest, but I just want you to know that's out there still, and that at some point the board needs to reconsider that. Whether that's through TNL or through here, I don't have a preference, but.
Dr. Piazza?
I think the proposal we made was that it would come back
Or to the-
through by March 15th of next year.
Okay.
And so it would go to TNL first for content and then come here for budget approval.
Okay.
Yeah.
Okay.
I guess the only question I have is, what is indirect?
That allows us to, it's like the administrative cost to all the approvals.
Okay.
So we've been claiming that as we go.
Yep.
And what happens with those dollars is it's part of our fund balance at this point. But
Okay.
to me, we're clearing the books quicker,
Okay.
but the dollars are, I forget what the percentage is, but it's like a,
Yeah, I was just going to say, there's a set percentage that
Yeah.
DPI allows us to
Oh,
collect
okay.
on that. I think it's 5 something
Yeah.
this year.
I don't know
5,
I don't know the number off the top of my head, but that's what that is.
Okay. Thank you. Any other questions about the ESSER funds? All righty. Thank you very much. So other business, is there any recommendation for future committee meetings? Anybody? Okay, if anything pops up, email Darren and Joe Como, and they'll get that on the agenda. All righty, so do we have adjourn to?
I don't have anything for us to certainly come back into open session for, and all I guess I would ask is that you look at, on the information on the lease of Pleasant Hill. If you have questions on that, I'd hope to have a response on that whole conversation, but I didn't get one today, so I'll be bringing that back more than likely in November. And those type of lease agreements, because I don't remember the last one we approved, F&F has the final say on those. So you'll see it on the board agenda, and I always agendize it on the board agenda as well, just in case this board wants to refer it to the board for a larger conversation, but you are under no requirement to do that. So unless you want to go into closed session and discuss that document, we can certainly do that.
May I ask a clarifying question?
You sure can.
So you're waiting for red line revisions back from them?
I sent them a document and said, this is what I'm presenting to F&F tonight. Please confirm that you're good with it, and I didn't get that call. And I don't think it means they're not interested, because we've
Right.
had very good conversations up to this point, but I just want to make sure that we have an agreement before asking you to.
Yeah, before we vote on an agreement.
This is then being backdated to July?
Yep. Actually, the current agreement goes through this year, but we just thought we'd clean it up with a brand-new document, different rates, those types of things.
The current agreement goes through 23.
Yeah, we're not outside of the lease, are we?
No.
No.
Okay.
We just thought
We
we'd
have
bring that
time.
last year into a new document.
Yeah.
And I think it even says in the agreement that this replaces,
It does, yeah.
so that was our thinking. And I think the rent's the same, I think the maintenance charge is the only difference. And it's in our favor.
Do we feel there's a need to go into closed session to discuss the document?
We're not pressed for time, so not at this time.
Okay. Is there anything else?
And I'll agendize it the same way where we can go into closes next month and reconvene, assuming a deal comes together. Same with the other topic.
The other topic, we do not have to discuss.
No, we're in conversations with that.
Okay. Excellent. All righty. Well, that concludes our meeting. Thank you, everybody, for your time, and have a good evening.